The board was established 50 years ago this year to provide treatment, planning, implementation of programs in both the mental health and substance abuse field. Today, we're serving over 12,000 Geauga County residents with prevention and treatment services across our contract agencies.
Whatever problems are affecting the growth of our businesses in Geauga County, that becomes our mission to solve. And so currently, workforce is a major issue for our companies to be able to have an adequate workforce, skilled, drug-free, that can help them grow their companies.
I think our business community can help to prevent and respond to the drug crisis by, first of all, implementing a drug-free workplace policy. And it's more than just implementing the policy, it's also living that policy by good example. Our businesses also can provide the necessary referrals and assistance to individuals that are experiencing difficulties with addiction issues.
Alcohol and drug abuse impacts our business community in several ways, but loss of time, accidents that can be quite expensive, and also production. It affects the bottom line of the company. Besides what it's doing to that individual. So it's devastating on those companies as well as those families and those employees.
In my tenure here with the Hemmings Jobs, we've talked with a lot of employers over the last number of years, and one of the number one responses and questions is that they cannot find new hires that have a clean background and that can also pass a drug test. That is oftentimes our number one question on what can our employers do because of this particular issue. I've also talked with employers that haven't had any type of drug issues until recently, so they have really nothing in place to assist their an employee that may have a drug issue, so they've actually contacted us with, can you help me? What do I need to do to help this individual and help my workforce?
The biggest misconception that I run into in the field about treatment is that it doesn't work. That treatment is a waste of time, that individuals don't really want to recover from their substance abuse addictions. What I tell them is that, in fact, we often know people in the field that have gone through recovery and sometimes sustain recovery for decades and go back to be trained in substance abuse prevention and treatment and become the counselors in that field that actually are serving other people with addictions. And so that's some of the most rewarding stories that we have, is how people give back after they have gone through the recovery process and treatment process themselves. But recovery is a lifelong endeavor, and I think we need to encourage and support those people that are in recovery.
An employee's mental health or drug dependency is not unlike a medical issue. And we need to treat that just like we would if someone had cancer. And so our companies can be, very proactive in bringing in the agencies that, as the board and along with their partner agencies, to help their employees recover from alcohol or drug dependency.
Medical science today has shown us pictures of an addictive brain, and we know that the brain physically changes in the brain of a person that is addicted to substances. We also know that in treatment, that brain can change yet again. It's often part of the goal of a person that's had a stroke, for example, where the brain has been damaged. They know that treatment can change the makeup of the brain. We know the exact same thing for substance abuse. We know that treatment can actually rewire the brain and help people to regain their recovery and continue their treatment.
It's important to know that the board is involved in these drug-free initiatives, and it's even more than that. It's a partnership. It's an all-inclusive partnership with a number of agencies. So we have one go-to agency who businesses can go to in order to deploy the necessary responses.
We have many ways to receive help. We have many ways that they can contact the community of providers and find out what kinds of needs can be met through the treatment providers and prevention providers that are already here. So often I hear when I go out and give a talk to employers or to the public in general, well, I didn't even know those existed in Geauga County. And I think we have a full continuum of care that employers and the public in general should be made aware of. They can go to our website, they can call 211, they can also call our emergency cope line 24 hours a day and get help. I would encourage them to go to the website, recovery.org. There are many stories on that site that show how often people recover and some of the very good success stories that are available throughout Geauga County as well as the state of Ohio. Every day we meet people that have gone through treatment, have recovered from their substance abuse addiction, and go on to lead very productive lives and very happy lives. The Geauga Board was started in 1968 with just a handful of individuals that met on the steps of the county courthouse for their first board meeting. After that, they created a series of programs and agencies to meet the needs of the community, and that still exists today and has been expanded, and we have a full continuum of care in Geauga County. 50 years have gone by. Thousands upon thousands of volunteer hours have been put into creating this community of care, and we're proud of the services that we bring to the community.